We've all heard the term e-health or digital health or ICTs for D or for health. All of that to me is all, refers to health informatics. It's all the use of technology to improve health outcomes.
Certainly there are some challenges. First, because the discipline of health and technology did not grow together. Health has been growing over the years, and technology came not so long ago. And now we are trying to improve the quality of health services by bringing this together. You must have heard about mobile health or use of handheld devices by doctors or community health workers to do better what they do. And also there is also a spring and a growth of many applications and hardware to sort of come into the development world, including health. And some of them are not well coordinated. And those who are charged with the responsibility of reviewing and assessing whether they are appropriate may not always have the skills and capacity to evaluate them and see how well they sit.
The challenges I also like to think about are at the decision maker level. Are we creating a culture of data use? Like, how do we do that? Because often, not only do the health workers or the people that you're working with in the villages not have experience with technology, but also the people in the Ministry of Health don't necessarily have that much experience with technology. They don't have experience with having data arriving in real time and like doing things with that data. And I feel like those are things that we take for granted here in the US, like, data mining and like doing things with the data that we get, but that is still something that is still being learned in developing countries, and that's a challenge that I see, because if people who are reporting and using those mHealth applications do not see the feedback, do not see the results of the applications that they're using, they'll stop using them.
There are a couple of things that need to be done. One is to start at a position where all these items and components are brought together through developing a framework, an electronic health framework that governs and guides adoption of all these technologies. Yes, there are challenges of electricity and technology and so on, but gradually we can only get better. Countries have motivation to do this better. But there needs to be a concerted effort to develop electronic health frameworks that have been developed collaboratively. There's buying in from different stakeholders and governments. And when that framework is drawn, then all these other things can fall into place in a coordinated format. Certain quarters have argued that we should have health information systems that are uniform across countries instead of allowing different entities come up with their information systems. I tend to differ because it doesn't matter on the road, there are all different types of cars, but the road is the same, and traffic lights are able to control all these cars and have a coordinated traffic flow in cities and towns. So my proposal is that allow these information systems to come up, but have some rules. These are what we call standards. All these information systems should meet particular standards so that at the end of the day, these systems can be able to exchange data, because the ultimate goal is to link up these systems and have strategic information for health managers to make decisions about their patients, about the community, and ultimately about the population.
What we will see more is more conversations about interoperability, more conversations about standards, more emphasis on the ability to exchange data and from different systems and have them populate, one dashboard or something for people to be able to look at. And we're also going to see, I think, and I hope, we're going to see more conversations about interoperability between programs and organizations, so that you don't have, Project A giving your community health worker a phone and Project B giving that same community health worker another phone, so that they can both report to the different projects using both phones, where maybe half of the indicators they're reporting on actually overlap.